Hey guys, this is Thomas over here at NurseMoneyTalk.com, and in this video, what I want to do is I want to talk about what a nurse is. But what I also want to do is I want to take it a little bit of a step further and talk about who exactly a nurse is. Now, if you're wondering, what's the difference, I'll tell you what the difference is here shortly. Before I get to that, though, if you are not already subscribed, I want to go ahead and invite you to hit that subscribe button on this channel, talk about all things nurse, nursing student, nurse life. With that said, let's go ahead and get started with what is a nurse. Now, in a nutshell, a nurse is a caregiver who helps patients by managing their physical needs. Now, of course, if you've watched any of my other videos, you know I'm a nurse. And in a nutshell, what I'm doing or what nurses do is that we help manage the physical needs of patients. We help prevent illnesses for patients. We help with treating medical and health conditions of patients. Nurses are observing and monitoring and also recording recording kind of like the progression of like the patient's condition. So whether a patient's getting better or worse, we're documenting that. And then in general, nurses are critical when it comes to decisions that are made relating to a patient's health. With that said, let's talk about for a second who is a nurse, because I already just talked about what a nurse does, but who exactly is a nurse in a broader sense. Now I'll have another video that you can check out where I'll talk about granularly, like in detail, kind of like the duties of like the specific job duties of a nurse. But in general though, in terms of who is a nurse is a patient advocate, because as a nurse, a lot of times we're stepping in certain situations to make sure that things are going in what you would call the best interest of the patient. So what that means, for instance, is for example, during procedures, nurses are typically the ones who are stopping the line, making sure that, did we time out correctly? Did we do our last double check, safety check to make sure that we have the correct patient and we're doing the correct procedure? A nurse is, typically the one who's advocating the patient, making sure, did you sign the consent? Are you actually agreeing to this procedure? And for instance, do you actually even understand what procedure we're doing? And then along with that, nurses are the ones who are, they'll step in, make recommendations based on what's in the best interest of the patient or based on what they've seen or heard the patient express. Because one of the things about nursing is that they are the ones who are typically with the patient 24/7. Now, moving past the patient advocate part, a nurse is a teacher. And what that means is that, education is a big part of nursing. So if you take the instance of the patient who has diabetes, it is a nurse that's gonna educate you on how to manage your illness. Maybe you just recently got diagnosed with diabetes and you don't know what that is. A nurse will educate you on that. On top of that, nurses are counselors. And so, you see this kind of shown very strongly, like if you've ever worked in mental health, or if you do get an opportunity to work in mental health, where you get to lend your ears to a patient who has a lot of issues, a lot of concerns, a lot of worries in this world, and you get to hear them out as they express their frustration. There's something very therapeutic about just being able to express what frustrates you and knowing that there's somebody there listening to your concerns. And even if you're not in mental health, whether it's like med-surg or whatever, med-surg, You're going to see situations like that, even if it's in the ICU. Maybe it's not necessarily to the patient in particular, but maybe it's to the patient's family or patient's loved ones. Then the patient's on a vent or whatever. The patient's prognosis doesn't look that good. You get to wear that hat, and because you wear that hat of that counselor, a lot of times then you also wear the role of being a confidant of the patient or the family members. And so because of HIPAA, I think in general it's widely knowledge that your treatment, whatever said or whatever, that's a medical professional can't just go and start telling everybody about that. And so with that said, patients then can have the confidence of knowing that they can express their concerns to you, and know even in situations where they can't tell their significant other, they can't tell their parents, they can express that to you, knowing that you will hold that, obviously in confidence, unless there's, some other, unless there's situations when you can. But all that aside, and so those are just some of the many roles that nurses wear. And if you're watching this and if you are thinking of becoming a nurse, you can go check out some schools by going to nursemoneytalk.com/schools. Or if you would like to find out more information about nursing, make sure you check out one of these other videos that you'll see that'll show up over here shortly. Thank you so much for watching this video, and I'll catch you very soon in that next one.